Welcome to Charter California Edition. I'm Brad Pomerance. We are joined today by Hilda Solis. She recently ended her tenure at the Department of Labor as Secretary in the nation's capital. She is now vying for a seat on the Los Angeles County Board of Supervisors. It's an interesting move, but if one knows government, and especially California government, Board of Supervisors can really do a lot.
I think so. It's best to be home at the local level. You can immediately see returns. You can see projects funded. You can actually make decisions and policies that won't take 5 to 10 years.
Right.
So I think it's the best place to be. I started out at the local level at community college, and now to be back home I think is just fascinating. And it's good because there's a lot of people who really need issues of job creation, economic development, job training, better health care, all kinds of things that are right now in need of attention.
Let's talk about health care, because as you know, the county in many ways becomes the arm of the federal government or the state in terms of funding of healthcare dollars.
Right.
And as we go through the implementation of the Affordable Care Act, a lot of those dollars will be flowing through to the county, especially as it relates to the Medicaid expansion, which California has accepted. What do you think about California's decision to accept the Medicaid expansion?
I think it's great. I think that it's going to save money in the long run, particularly because we're going to be able to provide the kind of fully bound assistance for people, so we can do prevention. We can help mitigate any of those emergency trauma visits by providing more prevention and having more doctors and nurses on the ground helping to identify these illnesses and giving people, you know, more of a choice at what kind of assistance is available. People won't be discriminated against. Women won't be discriminated against. Pre-existing conditions can't keep you from seeing a doctor.
What's interesting about the expansion, at least as it relates to California, is that the expansion has been so successful, so many people signed up, that the state is actually going to need to set aside more money for the expansion. Because what I recently learned, for those that are newly covered under the expansion, federal government will pay 100%.
Right.
But if the person had been eligible before, but didn't sign up, but is now signing up, the state is required to pay 50/50.
But you know what's interesting is we should have been doing that a long time ago, but we were stifled because of folks in Washington not wanting to do that. And as you know, there are states in other parts of the country who refused to really enact full body like California did. So we have, I think, a different moral obligation here. We want to provide coverage because in the long run it's going to save dollars. So if you look retrospectively and even into the future, you're going to see you're going to see that we're going to save a lot more money because more people will have the tools in prevention. There'll be more doctors, there'll be more nurses, there'll be more healthcare providers. So we're moving in that direction. And I think, look at Massachusetts and other places that have actually had some time doing this. They've actually seen costs go down. You're going to see prescription drug go down. You're going to find more people involved, and I think that's going to bode well for us as a society.
What's interesting is the Republicans recently in the House of Representatives held a hearing whereby they invited members of the insurance industry to come testify about insurance rates. And we heard through back channels the Republicans expected the health insurance industry to say, oh, rates are going to continue to go up because we haven't seen the cost containment, but they didn't. Well, they said the opposite.
Well, actually, that's what the president wanted to see happen. He wanted to make sure that insurance groups were not taking too much on the top for administrative, and that they had to have a certain percentage that would actually be the criteria for more service dollars to go back into the system instead of having it go on to administrative costs. So that was a big deal. There was a big fight with the insurance lobby because they wanted to protect that money that they could take from the top, and we wanted that money to go back in to services, and that's exactly what the public wanted.
As you look toward joining the Board of Supervisors, you know, as we mentioned, that the county is an arm that will handle a lot of the health care maintenance and decisions. Is Los Angeles County ready for this new influx of patients that are now signing up for health care?
Well, I think that, you know, obviously there's going to be adjustment. It's going to take some time. It's going to take its time to implement fully. But I feel very good about what I'm seeing on the ground. Even talking to people who work with the county in healthcare facilities as well as clinics that are going to be recipients of this service as well, and funding, that people are starting to gear up. They know that they can handle it. And the good thing is that California is ready to take that risk. We're not afraid to implement that. that because we know in the long run it's going to take care of people that we care about, our neighbors, our family members. It's going to help to reduce costs overall.
When we look at the profile of the individual that signed up, either through Covered California for health insurance on their own or through the Medicaid expansion, the early numbers were a little frustrating for those that were hoping to bring on individuals of Latino descent. Our state has a large Latino population, and if Obamacare was going to work, we needed those numbers.
And you know what happened there was that we didn't have enough people that spoke the language, that were bilingual. And like anything else, any program, you have to have a good marketing plan set aside so you target those individuals. And I think that we're getting there, and so there still will be more room for new people to come in. So I wouldn't say that everything is how could I say, concrete. It will change, and I think as more people learn about it, they're going to talk to their neighbors in Spanish. They're going to talk to their aunts and uncles.
But what was interesting is while the early reports were that California was not ready to invite Spanish speakers, by the end, the numbers of Latinos that did sign up was at some level not bad.
Remarkable.
Yeah, in the end, at the end, our Latino residents and friends wound up signing up.
And I'll tell you, there's a lot of groups, nonprofits and philanthropic groups that helped us, like the California Endowment, that really did a good effort working with our Spanish language media in getting the word out. So that's so critical to this changing demographic out here in California, particularly in Southern California.
What's interesting about the Affordable Care Act, and it was part of a grand compromise, is that only those that are documented can access services through the Affordable Care Act. You may or may not know Ricardo Lara, Senator Ricardo Lara, is looking at a bill, obviously focused in California, that will provide health insurance in California for the undocumented. What do you make of that? Do you have a position yet?
Well, I think it's, it's laudable, but of course it's going to be costly, and I think that there are two things that have to happen. First of all, we need to have more support and funding also from the federal government. The only way that will happen is if there is immigration reform. So right now is the time to start putting pressure while we have a window of opportunity to contact the Republican members of Congress that right now don't want to move that. They have an opportunity, I think, an obligation to do it, but many are holding back.
What's so interesting, and if I want to ask you about immigration reform, because you did spend, I think it was 12 years in Washington. I had the honor recently to interview several members of Congress recently in our nation's capital. When I spoke with members of the Congress that were Republicans from California, they sounded like they could have been Democrats from California. I mean, the California delegation is solidly behind immigration reform. But it's your friends that are not from California who are Republicans that are just not there.
Well,
so what's a Californian to do?
Well, I think that you do look at leadership like Senator Lara and others, and even the County of Los Angeles, which has a program right now that provides assistance at clinics. And that, obviously, that pot of money is finite. There isn't enough for everybody, but perhaps putting pressure and making sure that we're covering people so that we have prevention.
But what
prevention will help reduce those other costs that will, down the line, end up costing you and I, if someone who's documented or not has to go to USC Med Center because they have to go see a trauma. They have to go to the trauma center, which costs $5,000 a visit.
But what can be done on the, I know you're running for Board of Supervisors now, you're not in the federal side, but on the question of immigration reform, because it is all tied up. You know, when a California elected sees it as a must.
Well, I'll tell you, right now the county is mandated to provide a safety net of services, and healthcare is one of them. So we are not fully funded for that. So we do need to attract the attention of all federal members in the Congress and in the House, our senators, and make sure that they fund what they ask us to do. And so that's going to be a big priority, going back there possibly in the future saying, hey, guess what, fellow Congress people, you asked us to do this by law, but you're not paying us to do it. So you need to step up to the plate.
Well, we know in terms of unfunded mandates that California is absolutely a donor and not a donee, whereas our friends in Texas, well, they're a bit more. So in our final moments, are you feeling like the news is good for the Affordable Care Act in California? You feel like
believe
we're on the right path?
Absolutely, and I believe that we're going to see a whole slew of careers being developed around healthcare. I've been to several graduations this month and have seen so many people becoming interested in healthcare professions, and there's an industry there that is going to address that. People are going to live longer. They're going to have choices.
Her name is Hilda Solis, vying for a Board of Supervisor seat in LA County. I'm Brad Pomerance. It's California Edition. Welcome, it's Charter California Edition. I'm Brad Pomerance. We are joined by Dario Frommer. He was a member of the California State Assembly from 2000 to 2006. He was Majority Leader, Health Committee Chair in the Assembly, now works at Agin Gump Law Firm. And I want to speak with you about an initiative that will be on the ballot in November, is that right?
That's correct.
Do we have a number yet?
No numbers yet. Coming soon.
Okay, coming soon. But I think it's fair to say it is the grandchild of Proposition 103.
Yeah.
Which was the initiative that was passed in 1988 that regulated car insurance. Very popular, fair enough. Would you agree?
Yeah.
With Prop 103?
Absolutely.
So it was a bit surprising to many of us, including me, that you have come out against whatever the initiative number will be. Talk to us about why you are concerned about an initiative that would regulate insurance a la Prop 103 for health.
Well, I think one of the problems with this initiative is it is written to put health insurance into an auto insurance construct, and that's a huge problem because health insurance is very different. The other thing I'm concerned about here is the impact of this initiative on the California's excellent work that they've done implementing the Affordable Care Act, Obamacare. Our exchange is widely regarded as the best in the country. We've got 1.4 million people insured at rates that are very, very good, widely recognized as some of the lowest rates. So when someone's doing a good job like that, why would you come in and tinker with it by creating another layer of bureaucracy over that agency to second guess what they're doing? It doesn't make sense to me.
But let me ask you if I may, because with Covered California, they are not setting rates by any stretch. They are merely an exchange where insurance companies sign up and then the individual goes online and selects their product. The initiative, as I understand it, would basically require regulation of those rates. So how is that implicating Covered California?
Here's what happens. Covered California says we have so many people need insurance, and they go to the health insurers and say, come to us with your proposals. Let's look at your network, the doctors that you have in it, the coverage, the price.
Right.
They are negotiating right now, and by all means, and all measures, they did a really, really good job on the pricing, and obviously the benefits are pretty much set now by federal law.
Right.
In addition, what Covered California does is also mirrored in the individual insurance market for people who aren't eligible to use the exchange, so they're getting that benefit too, both on pricing and on what we call the essential benefits package. So to have somebody come in now and second guess Covered California and say, well, we're going to go behind your rates and make sure you did a good job negotiating or getting a good deal, and creating another level of bureaucracy by that in the Department of Insurance, it doesn't make sense to me because I don't think that system's long. What you have to know about this initiative is it doesn't cover most of us. 84% of Californians would not be covered by this initiative.
Because?
Because it only covers the individual insurance and small group market, which is really Covered California and a few other policies. It's only 16% of the market.
Because?
So the sponsors, because they wrote it that way.
Huh.
They wrote two versions of the initiative, one broad-reaching version that would have covered the large group employers, government employees, anyone who gets their insurance on the job in a company that's larger than 50. But they didn't file that. They filed this very narrow initiative that only really covers people who are in Covered California. And obviously, those people right now are the most protected in this environment under the Affordable Care Act. So what happens to the other 84% of us who are still having to deal with high insurance premiums, issues, high deductibles? There's no relief. There's no relief for the state government, local governments who are facing higher bills, for the employees, for those of us who get insurance on the job. This initiative doesn't provide that relief. And I think that's a fundamental problem I have when you're out there campaigning and saying, oh, we're going to get after health care rates, and you're really not helping most people. To me, it's a bit deceptive.
What's also frustrating for Californians is that as we look at the health insurance market today, there are so many different regulatory agencies involved. Your plan might fall under the Department of what's the stand?
Department of Managed Healthcare.
Managed Healthcare, or it could fall under the Insurance Commissioner.
Right.
It would seem like they should all fall under the Insurance Commissioner, but what does this initiative do on that front? Does it consolidate? Does it streamline the bureaucracy?
It creates more bureaucracy. You're absolutely right. 90% of the insurance policies that are written are regulated by the Department of Managed Healthcare. That department is appointed, the head is appointed by Governor Brown. Mm-hmm. Only 10% currently covered by the Department of Insurance. So this is a very big power grab for the Department of Insurance, because now they would set the rates for all policies that fall into the 16% silo that I've talked about. And when they get done with that, the policies that are regulated by the Department of Managed Healthcare would still have to go back to that department to be judged on whether the rates set by the insurance commissioner are actuarially sound, if the networks, the providers, the doctors, the hospitals included in those plans are going to be accepted by the Department of Managed Healthcare. The initiative is silent on how we manage this huge bifurcation of responsibility, and I think that's a major problem. It doesn't say how we're going to work that out.
I think part of the challenge is really the optics of the situation. When you look at the private insurers, year after year you see them engaging in huge spikes in coverage, in the cost to the individual consumer.
Right.
Now, are those spikes, are those days behind us because of Obamacare? It's hard to know.
Right.
But when you think about the optics of it, and you hear that we're going to pass an initiative very similar to 103, which has been very successful in decreasing car insurance rates, the minutia of whether it goes to this department or that department can get lost. It feels to Californians that we need some type of authority vested in someone that can say, no, you cannot raise our rates 39%, which is what Aetna tried to do right before the Affordable Care Act was passed. Talk me through that.
That's a valid concern. I mean, I think everyone is fed up with increasing insurance rates. And certainly when I was in the legislature, it's an issue I worked on a lot in terms of what costs. But when you look at what's driving costs in health insurance, one of the big issues is uninsured individuals, people who have to use the emergency rooms as their doctor of first resort because they can't go see the doctor.
But the good news is those numbers are dropping.
Huge down.
I don't care what you say about Obamacare. I mean, it is undeniable that the number of uninsured in America is dropping.
So to answer your question, what I'd say is this. The covered California rates were really good, very low. We just had a hearing by the Republicans in Congress who are not fans of Obamacare, and the industry came in and said they didn't see major increases coming for health insurance now because everybody's getting insurance, and we are already seeing some benefits from that. They may go up in the future, and I think that it's a legitimate question to say, how do we deal with that? And the Affordable Care Act authorizes states to set rates. The problem with this initiative is it's extremely poorly drafted to control health care costs. It only covers a small portion of Californians. It leaves 84% of us out. It gives the power to the insurance commissioner without dealing with how they're going to address the department of the fact that 90% of these policies are regulated by another agency. And then it has this intervener process. And the intervener process allows people to come in and fight the rates. In other words, anybody can show up and say, we don't like the rates you're setting, and they can go through a process with the Department of Insurance, which can also go to the Superior Court. 25 other states have rate regulation. All of it passed long before Obamacare. None of those states have the kind of long-ended intervener process that we have in California, and that's another concern. When you come up on, whether you're an employer or you're covered California, you have an open enrollment period that people have to have time to get their insurance. It's once every year. Everybody knows when it is. If your insurance products are not through that intervener process, then it raises a big legal question about whether you can offer the products. What happens to someone who says, hey, I want to renew with your insurer, and I can't do that. So the way this, what I would say is, the way this is drafted is just not good public policy. Why don't we do something that's going to work and not create more problems?
Which begs the question about initiative reform.
Okay.
It's a much larger question. I mean, it's not arguably that hard to get an initiative before the voters.
It's not.
And so what can be done?
I think a lot of things can be done in initiative reform. One is that we should tighten up the requirements on how many signatures. We should rate up the signatures. Some states have a process where you can propose something and then the legislature has like a year to see if they can fix that problem before it goes on the ballot. I think those are things worth looking at in California.
In 1988 when Prop 103 passed, the supporters spent $3 million, the opponents spent $120 million, and it passed.
Yeah.
Are you ready?
I think we're ready. I think it's the same situation. It's, look, it's a very popular thing, and all I can really say as someone who has worked in this field in public policy is sometimes the popular thing, if it's done wrong, can make things much worse. And I think that's what this initiative is going to do.
He is Dario Frommer. My name is Brad Pomerance. This is California Edition. Welcome back to California Edition. I'm Brad Pomerance, and Bob Bruesch is joining us today. He is the president of the Garvey School District, a K-8 district in the San Gabriel Valley. Give me a sense of the makeup of the Garvey School District.
Well, first of all, Garvey School District is one of the oldest school districts in the state of California.
Really?
We were incorporated in 1882.
Wow. And you've been there that long?
Yes, I've been there since the beginning.
But I must say, you have been there for a while.
Almost 50 years.
Right, you were a teacher.
Yeah.
Your whole career, you didn't move to administration, correct?
No.
But you became a school board member.
I became a school board member, and before that I was on the city council of Rosemead,
sure.
And the mayor. But I've been able to see the development of a cultural shift in our school district.
Tell us.
When I came in the 60s, it was about 85 to 87% Hispanics.
Okay.
And now the whole milieu has changed to 56, 55% Asian and about 37% Hispanics.
So at this stage in the development of relations between different ethnic communities, we've seen a bit of a rift between the Asian American community and the Latino community over an issue in education, and that is the question of affirmative action.
Yeah.
As you know, Senator Ed Hernandez, does he represent your area?
Yes,
so
he does.
represents your area. He was the lead author of a bill that would have asked the voters to reconsider Proposition 209, at least as it related to education, higher education. It sailed through the Senate, it got to the Assembly, and all heck broke loose. And ultimately,
Nicely put.
Yeah. And ultimately, there was a rift between Latino legislators and Asian American legislators. What Asian American legislators were hearing was...
it was very difficult to not hear the complaints about, well, look at, why isn't it done on merit? Why does it have to be set aside for one ethnic group? You know, Brad,
and let's talk about the background of that. It's important to recognize that since Prop 209 passed, if you look at the UC system, the CSU system, numbers of Anglos admissions dropping, numbers of Asian admissions soaring, numbers of Latino admissions also increasing, numbers of African American admissions flat to down. And I should mention, as part of that rift, the African American community as well was on the side of Latinos. I hate to create those alliances, but that's what we were saying.
It's very, very true what you're saying, but it's also very, very true if you look at the demographics of the state in the last 20 years. What has happened? Hispanics have gone up, Asians have gone up, Anglos have gone down, and the black community has basically stayed the same.
It's been flat.
So is our UC system becoming more reflective of what the reality in our communities are?
Well, I think it's undeniable, sir, that we are seeing demographic trends as you recommend. But it's also undeniable that Asian Americans are disproportionately represented on UC and CSU campuses. That is not a good thing or a bad thing. It's just a fact. I'm just stating a fact.
And you're not being racially biased.
I'm just stating a fact.
Yes.
And so, but what's also interesting is that one might argue that there's even a divide within the Asian community, because as I understand it, the Asian American numbers are particularly strong amongst Chinese Americans. And that is a community that is well represented in Garvey.
Let me explain a little issue that has gone unnoticed in the press, and that is what they call disaggregation of scores. On our testing throughout the state, all Asian scores were lumped in one group. And the Asian community itself said, this isn't fair, because there are certain groups of Asians that have difficulty in school. And it's not really showing you the breadth of the differences between the cultural groups. And let me give you
So what'd you learn?
Well, we are learning that there is differences within the Asian group, and even how quickly they learn English. We have a large Hmong population, very slow in gaining English skills, and they're not well represented at the UC, whereas our Chinese immigrants from mainland China going right up the ladder. And I'll give you a little insight. At the recent California School Boards Association meeting, we had a talk from Dr. Melba Beals, who was one of the 9 Little Rock students that integrated to Little Rock High School. And I asked her that very same question you asked me. I said, Dr. Beals, what do you think about affirmative action? And she looked at me and she says, well, honey, it isn't a matter of race or ethnicity. It's a matter of green.
There's no question that someone of color who grows up in an affluent community and is affluent themselves will likely do just as well as an Anglo in that same community. Generalization, of course. So what about affirmative action by zip code?
That's what we have to avoid.
Avoid
putting the onus on a community saying you're low income. What we have to do, here's what we have to do. We know that low income people, their children enter school probably a year to a year and a half behind their peers from affluent communities. The whole structure of financing schools in California, most everywhere else, is tilted toward the affluent
not anymore with local control funding formula.
Remember, LCFF doesn't give new money. It stops the cuts.
But it does, I mean, a school district like Garvey, you'll get a concentration grant because you represent...
We will.
Yeah, more than 55%, is it, of your population is low-income foster kids or English language learners.
And the whole idea about foster kids is becoming more and more important because of the new process the county is going through in finding new homes for foster children. And a district like mine that has a facility where these kids are going to be housed, we have a real problem with the foster children. However, one of the things that the society has to understand is that early childhood education, a Head Start, early Head Start, is, if we want to solve this disparity between the rich and the poor, that's where we start.
Well, it's interesting because, as you surely know, the Democratic leadership in the state Senate and State Assembly had been pushing a bill to create a TK program, transitional kindergarten. The governor wasn't so high on it, and it does not look like it's going to move forward in the form that had been desired by leadership.
And I am totally in favor of that. A transitional kindergarten, extra help for those kids to get the activities that help them learn about the world around them. Those type of things, when a child is 3, 4, 5 years old, is so important to their future in school.
In our final moments, with Senator Hernandez's bill dying in the Assembly, is a discussion about repealing Prop 209 in the past. Will we ever see that discussion again?
First of all, it's a political discussion. It's not an educational discussion.
Isn't everything.
Yes.
His name is Bob Bruesch. He is the president of the Garvey School District. My name is Brad Pomerance, and this is Charter California.